طيب، السلام عليكم ورحمة الله. Can you hear me, guys?
Yes, clear.
Yes.
Yes, boss.
Okay.
Yes.
How are you, first of all? And very happy to be with you again. Today, inshallah, as I have promised you and as I have announced, there is going to be a long clinical consultation case. Unfortunately, the candidate who has been selected to practice the case, he just apologized 2 minutes ago. So, anyone wants to take this chance? Come on, guys. It's just a case. It's a piece of cake.
Yes, I can. I can do, Dr. Muhammad.
Okay. Can you introduce yourself, doctor, please?
My name is Susan.
Hello, Dr. Sausan. Do you have a nearby exam?
Plan for the two.
Planning for that too. Okay, that's good.
We can give a chance to a nearby one if there is any one of them.
It's okay now, as if you have volunteered. So it means that you are ready to take the case. It's a piece of cake. No worries of that. طيب اوكي بسم الله الرحمن الرحيم الحمد لله وكفى وسلام على عباده الذين اصطفى ثم أما بعد. طيب, Dr. Sausan is going to be our candidate today. As I have told you before, the long clinical consultation scenarios right now, you are going to face two long clinical consultation in the PACES exam, in station 2 and in station 5. The whole duration of the whole time for the whole station is 20 minutes divided as follows. 15 minutes you are going to spend with the patient, and 5 minutes you are going to spend with the examiners. In addition to that, these 20 minutes are preceded with 5 minutes outside the station. Outside the station, you are going to be given a 5 minutes, duration to read the scenario, to prepare your mind, to prepare yourself, and they are going to provide you with pencils and blank papers. They are not providing you a pencil and blank papers haphazardly. These are very important weapons. You need to use them wisely. Okay, so let's start now with Dr. Sausan. Okay, Dr. Sausan, let me just move. Okay, let me just adjust the time for you, Dr. Sausan. This is the case in front of you. Could you please read it loudly for us? Dr. Sausan?
Yes.
This is the case in front of you. Can you see it?
Yeah.
Could you please read it loudly for us?
Okay. You are a senior house officer covering the medical screening clinic, a Mr. 6-year-old gentleman who has been referred to you by the GP for skin rash. Observation upon arrival to the clinic revealed temperature 36.8, oxygen saturation 97% at room air, heart rate 90 beats per minute, blood pressure 170/90, and 167/86. Respiratory rate 14 beats per minute. Your task is to obtain history and examine Mr. Atallah.
Okay, Dr. Sausan, I'm going to give you 5 minutes, okay, similar to the exam, but I just need to seek your attention that the next slide is going to be like this, okay? Whenever you want to ask for, or whenever you want to look for, just tell me, I want to look, for example, as if in this case is presented with a skin rash. So if you want to have a look over the skin rash, tell me, I would like to have a look over the skin rash. I would like to have a look over this. I would like to see this. I would like to check for this. Just tell me, and I will direct you
Yes.
to the thing that you want to see or you want to observe. Is that clear?
Okay, doctor.
Okay. Now, this is the scenario in front of you. You have a pencil, you have a blank paper, okay? Take 5 minutes and we will come back to you after 5 minutes, inshallah, okay?
Okay.
Okay, thank you. Okay, Dr. Sausan, are you ready?
Yes, doctor.
Okay, let me adjust the time for you. It's 15 minutes. Now you can start.
Hello.
Yes?
My name is Dr. Marghani. I'm a doctor in the talking to Mr. Atallah, 36 years old.
Yes, I'm Hashim Atallah.
Okay, Hashim Atallah. How can I address you, Mr. Hashim Atallah?
Call me Hashim.
Okay, Mr. Hashim. It's come to my knowledge that you are suffering from, we are here suffering from skin rash. So that we are here to discuss this health condition and examine you and will address your concern. Is that okay with you?
Yes, doctor, sure.
Okay, Mr. How this
Dr. Sausan,
skin rash?
once you entered inside, okay, you have
Yeah.
faced, once you entered inside, okay, you have faced this patient.
Yes.
Okay?
Okay.
No.
Can you tell me more about your condition, your health problem?
Doctor, actually, I have been suffering from skin rash, okay, for the last 5 months.
Yeah, 5 months. Okay,
Yes.
Mr. Hashim. Can you show me your rash?
Yes, doctor, sure. This is the rash.
Okay, Mr. Hashim. Is it in anywhere other than this area?
No, doctor. No, I didn't notice any other areas.
His abdomen, yeah?
No, this is in the anterior neck.
Anterior neck. Okay. Okay, Mr. Hashim. Is this condition progressively increase in numbers of this rash?
Yes, doctor. Yes, I have noticed that it's increasing in number.
Okay, Mr. Hashim. Can you tell me anything make it worse?
I didn't notice anything. I didn't notice anything, doctor.
Okay. Okay, Mr. Hashim, are you with me?
Yes, I'm with you.
Okay, is rash is painful?
No.
Itchy?
No.
Any secretion? I mean, any oozing?
No.
Okay. Okay, Mr. Hashim, is this rash associated with any raising body temperature?
No.
Hello?
No. No.
Yeah, any change in your weight, Mr. Hashim?
Yes, doctor. Actually, I'm gaining weight nowadays.
Okay, how many kilos over how long?
I don't know exactly, doctor, but actually, I have noticed that the ring is no more fitting my finger, and as well as my feet.
Okay,
Yes, I was wearing size 6. Now I'm wearing size 8.
Okay, Mr. Hashim, sorry for this. Is this weight gain distributed all through your body, not in a specific area?
No, I think, doctor, it's mainly in my hand and my feet.
Okay, any associated joint pain or stiffness?
No.
Okay, any problem in your vision, Mr. Hashim?
Like what, doctor? Yes, I have got some vision problem.
I mean,
yeah, you know, doctor,
yeah.
last month.
Can you tell me what exactly you are suffering from?
You know, doctor, last month, okay, I had an accident. Suddenly, I discovered that there was a car just coming from the right side. I didn't see that car at all.
Okay, I'm sorry for that, Mr. Hashim.
Thank you.
Is any double vision?
Again, there is a connection problem. Could you please repeat your question?
Yeah, you have any double vision?
No double vision.
Any problem in your visual acuity? I mean, to see near or far object?
I don't think so.
Any pain in your eye?
No.
Any redness?
No.
Any headache, Mr. Hashim?
Yes, doctor. Actually, recently I have been suffering from headache. Yes.
Okay, can you tell me, is it in one side or all through your head?
No, actually, it's you know, doctor, I think it's in the middle of my head.
Any associated nausea, vomiting?
No.
Any increasing by sneezing or coughing?
Yes.
Okay, Mr. Hashim, sorry for that. How are you now? Have you any headache now?
No, I don't have any headache right now.
Okay, Mr. Hashim. Okay, Mr. Hashim, do you have any problem in climbing a stair or combing your hair?
Yes, doctor. Actually, I'm feeling very tired nowadays.
Yeah, what do you mean by tired exactly? Any weakness you mean, or just feeling?
No, as you have mentioned, especially climbing the stairs, it's becoming something very difficult for me.
Okay, Mr. Hashim. Hello?
Yes, yes.
There is-
Carry on.
Yeah. Yeah, any weakness or abnormal sensation in your body?
I didn't notice, doctor.
Any pain in your hand, Mr. Hashim?
Pain? No.
No pain, no tingling sensation.
In my hands?
Yeah.
No.
Okay, Mr. Hashim, do you have any problem in your
I think there is a connection problem with you, doctor. Could you please repeat your question again?
you take time to answer for me. I don't know why.
There is a delay. Guys, is there a delay?
Yes,
On
there is
my side?
delay. But yes, both of you, but you're everyone clear. But there is delay between you and her.
Can you hear me right now?
Yes. Yes. Yes.
Okay,
My connection.
This is a quick response. So I think there is a
From you, doctor. Yeah.
Okay, carry on, Dr. Susan.
Okay, doctor, where I was, stop asking. أنا وقفت وين يا ربي؟
Following problems.
What?
Following problems.
Yeah, Dr. Hashim, do you have any swallowing problem, I mean?
No.
Any problem in your speech?
No.
Any change in your feet?
My feet size, you mean?
Features, anyone told old one? Your feature in your face, I mean.
Yes, yes.
Any
Doctor.
difference between now and the old one?
Yes, yes. I have noticed these changes. If once I compared, okay, my current situation with my old photos.
Yeah. Okay, Mr. Hashim, do you have any problem, acid brush sensation or heartburn sensation?
No.
Any tummy pain?
No.
Okay, any back passages, I mean hard stool or blood in stool?
No.
Okay, no blood in stool also.
No.
What about your water work, Mr. Hashim? Do you have any problem in amount, frequency,
No,
any fresh urine?
no,
Okay, can you tell me, do you have any cough associated with this problem?
cough, no,
Cough, yeah. Any chest pain?
no,
Any racing in your heart, Mr. Hashim?
no,
Okay, Mr. Hashim. Any joint pain,
no,
stiffness?
no.
Okay, Mr. Hashim. Okay, Mr. Hashim, can you tell me what are you doing for a living?
Yes, I'm a teacher, doctor.
You are a teacher. Okay. How much affects your job, this condition?
It's really affecting me too much, doctor. As I have told you,
Hello?
it's really affecting me too much, doctor. As I have told you, last month I was hit by a car coming from the right side. Okay.
Okay.
And I have several
Sorry for
issues
that.
in climbing the stairs because, I used to climb the stairs to the second and the third floor very easily. But nowadays I cannot.
Okay, Mr. Hashim, we will address this concept with
And I
we will
have
address this
another
problem in
issue.
this regard.
And I have another
But
issue
by the
also,
time being, I
doctor,
advise you to stop.
I would like to tell you about.
Yeah.
Actually, my wife
Okay.
nowadays is being suffering. She's keeping telling me that I have very noisy snoring during night.
Okay, Mr. Hashim, sorry for that. Also, by the time being, I advise you to stop driving, Mr. Hashim, because till investigate you and see how we can help you. Okay.
Oh, okay, doctor. Okay.
Are you with me, Mr. Hashim?
Yes, I'm with you.
Okay. Yeah. Is this snoring associated with any daytime sleepiness?
Sometimes, doctor, I feel very weak during the daytime.
Okay. Any headache at the morning?
In the morning, no, but I have headache from time to time, as I have told you.
Okay. Okay, Mr. Hashim. Any mood problem, Mr. Hashim?
No.
Do you feel any? No mood change. Okay. What do you have any past medical history apart from your suffering?
No.
Okay. Do you have any history of hospitalization before?
No.
Any surgical operation? You mean no? No. Okay.
No.
What about? Do you have any drug that used for a long time?
No.
Okay. Any allergic known to be allergic for any medication?
No.
Any over-counter medication?
It's only paracetamol, doctor.
Okay. Okay. Use any recreational drug?
No.
Okay. Okay, Mr. Hashim. Also, I'm going to ask you some private question. Do you have any problem in your intimate relationship?
No.
Okay, that is good, Mr. Hashim. Okay, Mr. Hashim. In the family, do you have any similar condition in your family?
No.
Any family history of any long-term disease
No.
or cancers
No.
like this?
No. Just only diabetes and hypertension.
Mr. Hashim?
Mm-hmm.
Yes. Okay. Can I examine you, Mr. Hashim?
Yes, sure, doctor. Sure.
Yes. Okay. By general inspection of the patient.
Okay. General inspection.
Yes.
This is the patient in front of you.
Yeah. Patient has features suggestive of acromegaly. He
This is
have
not a discussion, doctor. This is not a discussion.
okay. Okay. I'm looking for
What do you want to look for?
okay. I examine the face for frontal bridging.
Okay. You mean you want to examine the patient from the lateral aspect?
I will start with the face and then to come to the hand. Okay.
Okay. This is the face in front of you. Just tell me what do you want to look for? I will guide you there.
I will look for frontal bleeding.
Okay. Mm-hmm.
Okay. Yeah, I group also autism.
Okay.
Can you open your mouse, please, Mr. Hashim, for see any interdental spaces?
Okay. Just a minute. Yes, there is an increased interdental space.
Okay, Mr. Hashim, yeah, there is a size, increased size of your tongue.
Yes, there is an increased size of the tongue.
Okay, can I examine your eyes, Mr. By doing a visual field for this patient by following my hand?
Visual field.
Where
Okay, this is the visual field.
yeah. Yes. Yeah.
You see it.
Okay.
Okay.
Okay. I will also test the vision for acuity.
It's okay. Skip it.
Okay. After that, I thyroid any swelling in front of his neck.
No thyroid swelling.
Yes, there is this rash, which skin tags in his neck that you showed me before.
This is the anterior aspect of his neck. Would you like to look
Okay.
for anything else?
Any blackness or acanthosis nigricans in the neck or the axilla?
Okay, just a minute. You have noticed this rash at the back of his neck.
Yeah. Yeah. Axillary area.
Nothing in the axillary area.
Okay, I'm going down to examine his chest for cardiomegaly.
What do you want to look for in the chest?
I will examine for cardiomegaly. We'll allocate the apex beat.
Apex beat in the mid-clavicular line, 5th intercostal space.
Yes. Any adding sound or any murmur?
No added sounds, no any obvious murmurs.
Okay, the chest also by auscultation for any breathing sound, abnormal breathing sound.
Normal vesicular sounds.
Okay, I'm going down. Yeah, I
Time
go
is
to the
done.
hand, the
Time is
most
done.
important area, the
But
hand of the
just keep
patient.
going on, Dr. Sausan. Keep going on.
Can you put your hand in a pillow? Can I give him a pillow and examine his hand?
Yes, for sure. Okay.
Yes.
This is the patient's hand,
Yes.
and this is your hand on the left side. On the left side.
Spady-like hand, increase in size. I will examine the hand for a sign of carpal tunnel syndrome.
What test
by
do you
doing
want to do?
tunnel and funnel test.
Okay.
By tapping the base of
you
the
want to
hand.
instruct the patient to do this maneuver?
Yeah.
Okay, instruct him.
Any pain? Any pain during this maneuver by doing like this?
Instruct the patient from the first.
Reverse. Yeah, can you flex your wrist and put your hand down like this?
Okay.
After a while, do you feel any pain?
No.
Okay. After that, I will tap for any pain during tapping of the.
No need to do this, doctor. Okay.
Yeah. Okay. After that, I will see the pulse of the patient.
Pulse is already written for you in the paper.
Yeah, it is 90 per minute. Is it regular?
It is regular.
Okay. Okay. I will measure his blood pressure.
Blood pressure is already given to you.
Yeah. Also, blood pressure is high. Okay. Okay, Mr. Hashim. After that, I will going to examine for abdomen for superficial palpation and deep palpation.
Doctor. Skip the abdomen.
Okay. After that, I will go down to the leg to see enlargement of his feet.
Okay. Yes. Feet are really enlarged.
Yeah. After that, I will, what other? Okay, Mr. Hashim. Do you have any concern, Mr. Hashim?
I just want to know, doctor, what's going on with me.
Okay, Mr. Hashim. After I take, you are most probably have a condition that's called acromegaly. It is a medical condition in which there is abnormal secretion of substances, a protein substances that called growth hormone. It's from due to overgrowth in a gland in your brain that is called pituitary gland.
Okay.
Okay.
Uh-huh.
So that we need to investigate you to confirm our diagnosis.
Okay.
And after a team of doctors that yeah. Okay.
Is it a serious condition, doctor?
Yes, Mr. Hashim, I'm sorry to tell you that it is a serious condition if not treated.
Okay, doctor, you have mentioned that there is something going on in a special gland in my brain.
Yeah.
You mean, is it something you mean as a cancer, you mean?
Yeah, Mr. Hashim, it is fortunately it is a benign growth that called pituitary adenoma.
Okay.
Yeah.
So, if you have treated this condition, doctor, could these facial changes return back as normal as before?
Most of the features will be better apart from the bony change, but the soft tissue, the swelling in the hands and the cardiac, if there is any cardiac problem, it will become better. Otherwise, improving the feature there maybe. Hello, are you listening me?
Okay, doctor. Okay.
Some improvement may occur.
Okay.
Concerning your blood pressure and yeah, like this.
Okay. Sounds good.
Okay. Another concern?
No,
Or time?
thank you.
Any another time? Any reverse time?
Yes. Let's go now to the examiner's questions, doctor.
I have finished.
Actually, it's 21
Okay.
minutes right now. As I have told you that 6 minutes ago, the time has ended. But I told you just to keep going on. Anyhow, so this is the time for examiner's question. Will take only 2 or 3 minutes. Okay, Dr. Sausan, could you please summarize the history for us? The history.
Yes, Mr. Hashim is a gentleman of 36 years old, presented to us with skin rash and the high. After taking history from him, he's suffering from increasing his body weight, and this skin rash also associated with night snoring, and also from history that the patient has eye sign in form of he cannot see the side. Yeah.
Okay.
Yeah, the weight gain and the vision problem he has, and he's suffering from headache and tiredness.
Okay.
And we stare.
Okay.
And changing in his features. Yeah.
Okay. What did you find on examination?
On examination of Mr. Hashim, he has features suggestive of acromegaly, confirming by his facial appearance, and and the skin tags in his
Find
neck.
in the facial appearance? Could you please elaborate more?
Yeah, he has. Yes, he has. About the size of the frontal ridge, prognathism, and wide spaces, teeth, large tongue also, and there is bitemporal heminopia.
Okay.
Okay, and there is a skin tag in his neck, and acanthosis nigricans also is a positive sign, and his hand also showing a large spady hand and high blood pressure in his arm. Yeah, his pulse is also a bit increase in his pulse. Yes, also saturation a bit, low saturation is 97.
His pulse rate is still within normal range, doctor.
90.
What is the normal pulse rate?
I thought it is, his saturation is a bit lower. For me, up to 70 to 75 to 80, I put like this, like an okay.
The normal pulse rate is from 60 to 100 beats per minute.
Okay.
Have you examined the fundus of this patient, doctor?
Oh, I forget in my mind, but I forget.
Okay, what do you suspect to find in the fundus of this patient?
Yeah, I may find the papilledema, maybe if there is increase intracranial
Okay, what else could you find?
pressure. Fundal examination, he may have, if he has, I don't think diabetic change because he is recently 5 months.
Okay, would you like to have a look over the fundus for this patient?
Apart from papilledema, I didn't remember what to see.
Now, would you like to have a look over the fundus for this patient?
Yeah.
This is his fundus.
If possible.
Can you see it?
Yes.
What is this?
Yeah, there is papilledema.
Thank you very much. Okay, now I would like to ask you another question, Dr. Sausan. So what's your diagnosis here?
My diagnosis is acromegaly.
Okay.
Yeah. Complicated with obstructive sleep apnea.
Is it a pure acromegaly? Is it a pure acromegaly or associated with something else?
Yeah, pituitary adenoma. Due to pituitary adenoma.
Okay. So, if I have told you that this patient has got features suggestive of hypercalcemia, increase in the water work or increase in the urination with history of passing kidney stones before. So, what are you going to suspect?
Men 1.
Thank you very much. Men type 1. Okay, last question, Dr. Sausan. Give me the differential diagnosis of headache inside this patient.
The space supine lesion.
Secondary to pituitary adenoma, you mean?
Yeah.
So pituitary adenoma. What else?
Maybe due to his high blood pressure.
Thank you very much. What else?
Yes. Maybe tension headache.
What is his wife complaining of?
The morning headache.
So
morning headache will be going with obstructive sleep apnea.
Thank you very much. Okay, the last question. What is the differential diagnosis for acromegaly? Could you please mute? What is the differential diagnosis of acromegaly?
Differential diagnosis of acromegaly. Any increasing in weight, like Cushing?
No.
Despite that, there is no feature suggestive. But outside, when with the weight gain, I mean.
Okay, I will make your life easy, Dr. Sausan. If I have told you that, okay, this patient is complaining of milky discharge from his nipple.
Hypothyroidism.
Milky discharge from his nipple. And erectile dysfunction.
Okay, hyperprolactinoma.
Prolactinoma. Thank you very much. This is a differential diagnosis of acromegaly.
Yeah.
Thank you very much,
Your
Dr.
answer wrong. Your question wrong. I understand the question wrong. Okay, doctor.
Thank you very much. You did very well, Dr. Sausan.
Thank you.
So, guys, give me your opinions about this case. Well, let me ask Dr. Sausan first. How did you find the case, Dr. Sausan?
Yeah,
Is it a straightforward case?
Yeah.
Is it a spot diagnosis case?
Yeah.
But actually, you know how many minutes did you take in just only in the history? You took around 14 minutes.
Okay.
Just obtaining the history, 14 minutes. You need to finish the history as quick as possible. Yes, as quick as possible. Okay, you have done very good job. You have asked almost 99.9% of the most important questions that you need to ask in the case of acromegaly. I'm really impressed with this. Okay, and also you have examined actually 99.9% of the whole things that you need to look for in cases of organomegaly. However, you just need to be very quick. And you don't need to spend too much time in the history. Because you know that all of you guys, during long clinical consultation, you are going to be, or they are going to assess the whole 7 skills. Don't forget this. The skill that is going to be assessed in the history is only one skill. Is only one skill, which is the clinical communication. However, there are 3 skills. One skill is equivalent to 4 marks, guys. Don't forget about this. That is why I keep saying to my colleagues, don't take too much time in the history. You need to ask targeted history in a very quick way, because the history is going to give you only 4 marks. However, examination, there are 3 skills in the examination. So 3 multiplied by 4. So examination per se is 12 marks. So if you want to balance between 12 marks and 4 marks, which side are you going to select to spend time more? The clinical examination, exactly. And don't forget that during the clinical examination, you are allowed to obtain information from the patient. Okay, so my advice, don't take too much time in the history. Only just keep it targeted history, targeted question. And also the examination should be targeted as well. Okay, so guys, Dr. Sausan, do you have any questions or any comments about this patient or about this case?
No, doctor, thank you for the chance.
You are welcome, inshallah. I'm really impressed by your performance, Dr. Sausan. Very good job, mashallah alik. طيب, what else, guys? Do you have any other comments before I start addressing and tell you how to address and how to practice this case and how to master this case to get 28 out of 28, inshallah? Any questions?
السلام عليكم.
عليكم السلام.
دكتور مرسي والشباب كلهم، كيف حالكم؟
الله يبارك فيك.
أنا دكتور بدر الدين.
تفضل دكتور بدر الدين، حياك.
طبعا الأكروميجالي in the exam يعني is very extensive case، يعني you have to take issues يعني.
Yes.
In spite is indicated by these symptoms like main one and obstructive sleep apnea syndrome, and you need to ask about all the complications يعني.
Yes.
Even carpal tunnel syndrome and pain and okay. Regarding the Doctora, she did well, but I think she forget to ask about alcohol and smoking. Very important.
Okay.
Smoking cessation and alcohol, no? Because this related to the cardiomyopathy. Yeah?
You mean
if the patient is drinking alcohol, you have to
will
stop.
be having a very bad or negative impact upon the heart, you mean?
Yes.
Okay.
And the plan in the plan should mention the ophthalmologist and refer the patient for smoking cessation clinic, the sleep clinic also, because of obstructive sleep apnea syndrome.
You didn't
The
ask
patient
me
has.
about how to manage the patient.
I did not ask her about this question, actually, about management.
Thank you, Dr. Badruddin.
Okay, thank you very much, Dr. Badruddin. Anything else, guys? Any other comments, guys? Or any questions in the chat box? Let me just review the chat box. Any other questions?
Doctor, yes, I have question.
Yes, please, carry on.
During I take history from the patient, this examiner allow me to write the history in the paper or only bus I listen.
You are allowed to write, no worries. You're allowed to take the, yes, as I have told you initially, they are going to provide you with pencils and blank papers outside the stations, okay? And you're allowed to take them inside the station. However, when you leave the station, you need to leave them there. Is that clear?
Yes.
Okay. Any other questions, guys?
Did I mention to the patient the definite treatment is if you confirm surgery? Is it if it affected if I didn't mention like surgery in the clinical judgment to my patient?
We did not actually addressing the issue of the management, but I will address it in my explanation, inshallah.
I mean to the patient himself at the end. The concern of the patient, what do I have and what is the plan of management?
No, actually the patient did not ask about the plan of management.
Okay.
The patient asked already what is going on.
Not in this specific in the case.
Okay.
Yeah.
What do you need to ask for?
What do I have like this open question? Should I mention if it is confirmed it is a plan of management, it's surgery, definite treatment of this patient, of your condition? Or
yes,
unless
for sure.
he asks me?
Yes, for sure. Because this is the mainstay of treatment, the cornerstone of treatment is the surgical operation.
Okay.
You need to mention all of these modalities of treatment to the patient. The mainstay of treatment is surgery. However, there are some medicines which you can take, and all of these issues are going to be addressed very clearly with the gland doctor, which I'm going to refer you to. Is that clear, doctor?
Yes, it is clear now. Thank you.
Thank you very much. So, thank you very much again, Dr. Sausan. Okay, best of luck, inshallah. Keep practicing, keep practicing. The only weak point, Dr. Sausan, is you just need to accelerate your performance. That's all. MashaAllah. Okay, keep your tongue fluent by keeping practicing and practicing and practicing. Okay, this is the only thing that you need, Dr. Sausan.
Okay, thank you.
Very good job. Thank you very much. Now, guys, so this is a very common case encountered in the settings of PACES exam and Irish clinical exam. As I have told you, this is a long clinical consultation scenario. In the long clinical consultation scenario, you are going to spend 15 minutes with the patient and 5 minutes with the examiners. You need to use these 15 minutes wisely. And you don't need to spend too much time in taking full history. Your history, your questions should be targeted, okay? And this is what I do usually call the pentad or the long clinical consultation. You need to confirm by history, you need to confirm your diagnosis, you need to look for the causes and associations of that presenting complaint, and you need to look for the complications. All of these three parts are going to be obtained from taking targeted history: confirmation, causes and associations, and complications. Then you need to move to the examination. And as I have told you, spend too much time with examination because 3 skills are going to be encountered in examination, which means 12 marks. Then after finishing your examination, go to explain the condition, and you need to start addressing the management and addressing the concerns of the patient. This is what I call the golden pentat of the long clinical consultation. Okay. Now, in this case, in particular, if we want to apply the golden, the golden pentat, as I have told you, this is the case of acromegaly in front of us. History, examination, and management. Now, acromegaly. You need to ask questions to confirm the symptoms. You need to start by doing this manner. Hello there. My name is Dr. Sausan, one of the doctors in the screening clinic. Are you Mr. Hashim Atallah? Yes, nice to meet you, Mr. Hashim. Mr. Hashim, you have been referred to us by your GP because of the skin rash. Is that right? Now, guys, I need you just to pause and concentrate with me. Whenever the complaint is a skin rash, before you start taking or obtaining your history, say this sentence to the patient: can I have a look over it, please? Because this is going to be the key of the solution for your case. Believe me, guys, this is a very important tip. Whenever the complaint is a skin rash, or for example, any mouth soreness, okay, before you start obtaining anything, have a look over it. And let us take some examples. Like this patient, you went inside, you saw some facial characteristic features, and when you start saying that I need to have a look over it, you have noticed skin tags. And outside the station, the blood pressure readings were high. So high blood pressure readings, skin tags, characteristic facial features in front of you, even before you start obtaining any kind of information, you immediately got the diagnosis of acromegaly. Is that right? Is that right, guys?
Yes, true.
Yes,
By
sir.
doing this maneuver, believe me, you are going to save time. For example, I will give you another example. Psoriasis has got a special characteristic feature of silver scaly rash. From outside, if you have been told that the patient is having rash in addition to joint pain, you went inside and you asked the patient to give you a look to have a look over this rash, and you found silver scaly lesions in the extensor surfaces and in the knees, for example, in addition to joint pain. So a diagnosis of psoriatic arthropathy is being made immediately before obtaining any kind of information. Another example, if from outside the patient is diabetic or is having any thyroid problem, in addition to skin rash, you went inside and you saw that skin rash of a hypopigmented milky rash, suggestive of vitiligo. So your mind immediately will start telling you to start asking about autoimmune screening and to do an autoimmune examination. Is that right? Another example, for example, from outside the patient is having a skin rash, and you went in skin rash and mouth soreness, and you went inside and you had a look over that rash. You found a raised nodule in the leg, and you have noticed an ulcer inside the mouth. And by only asking a patient one question, do you have any soreness in your private area? And the patient told you yes. So what is the top of your differential diagnosis here? Behçet's disease. and you saw erythema nodosa.
Yes.
So this is the beauty of this thing, guys. Okay, so whenever you have whenever you have encountered a skin rash, immediately have a look over it. This is the first step. So always, when you ever got a skin rash or a lump or an ulcer, have a look over it. This is the first step. Then, here in this patient, immediately when you saw him, you have detected special facial characteristic features, as I have told you. So it's a spot diagnosis of acromegaly. Now, your mind will start telling you that, khalas, just relax. But let me hit you with this bad news. No, do not relax. Because examiners expect from you, when they give you a spot diagnosis, they expect from you to ask the most important questions, not like any vague symptoms. Once you have got a spot diagnosis, you are a lucky candidate. However, you need to master the case very well. It's a gift, but at the same time, it might be a bump. So be careful, guys, with these spot diagnoses, cochignoid feature, acromegaly, okay, any spot diagnosis, you need to make sure that it is going to be a gift, not a bump. Okay? Is that clear, guys? Any questions so far? Is my voice clear?
Yes,
Yes,
clear.
Yes, sir.
Okay. As I have told you, examiners expect from you to confirm acromegaly by asking about the symptoms of acromegaly. Then you need to go and ask questions to look for causes and associations. Is it a pure pituitary adenoma? Or is this acromegaly part of multiple endocrine neoplasia type 1? Or is it a prolactinoma, which is a differential diagnosis of acromegaly? Then you need to move to look for complications. And complications is divided into two portions. General complications in the term of weight gain, and specific complications in the term of acromegaly itself. Okay? Now, let us go back and start our journey with Mr. Atallah. After looking into the rash, Dr. Sausan analyzed the rash very well. When did it start? How did it start? Was it sudden or gradual? Is it progressive, regressive, or the same? I mean, you need to know the course of this rash. Is it the first time to have such a rash? And be careful, guys. This question is a very important question. It's also one of the weapons that you might use to reach to a diagnosis or to reach to a differential diagnosis. Is it the first time to have such a problem or not? Then ask specific questions related to any kind of rash. Now you have analyzed the presenting complaint. In addition to that, there are several important questions specifically for skin rash. The location of the rash. Is there any other sites? Any itchiness? Any pain? Any numbness? Any lumps or bumps? Any history of trauma? And have you noticed this rash increases with trauma or not? What is the most important? What is the importance of this question, guys? What is the importance of increasing the size of the rash in relation to the trauma?
Hemophilia.
What is this phenomenon?
Kebro phenomena.
Koppner phenomenon.
Koppner
Thank you very much.
phenomenon. Koppner
Thank you very much.
phenomenon.
Now, once you have done analyzing the presenting complaint, which is supposed to be the first thing you need to do. Okay, now there are two ways to go through in the history. In this case, where a diagnosis is clear in front of you, okay, you need to start immediately addressing and asking about confirmation, like what Dr. Zainab did exactly. Looking for causes, looking for association, and looking for complication. However, in other cases where the symptoms is vague, for example, like cough, the patient is complaining of cough. Now, we have learned that cough, it could be either a productive cough or a dry cough. And there is a differential diagnosis of productive cough with differential diagnosis of dry cough. And another key question, as we have discussed before, have you noticed any noisy sound coming from your chest? I mean wheezes. For example, this patient is having a dry cough and there is no any noisy sound coming from the chest. So this patient is having a very long list of differential diagnoses of cough. Believe me, guys, if you go through systemic review, which is usually the second part after analyzing the presenting complaint, believe me, you are going to lose the station. Once you have analyzed the presenting complaint immediately, guys, I want you to go immediately and ask about, number one, past medical and past surgical history. Is there any long-standing diseases or conditions I need to know about them? Is there any history of admission to the hospital before? Are there any surgical operations before? Then, number two, you need to ask about medicines. For example, in this patient with cough, if you have asked this patient, is there any long-standing disease I need to know about them? The patient would have told you, yes, doctor, I'm having rheumatoid arthritis for the last 20 years, for the last 5 years, for example. And when you ask about medicines, yes, doctor, I'm taking methotrexate. And the patient's complaint is cough, dry cough with no wheezes. So immediately, your brain will translate this. I need to put the differential diagnosis of interstitial lung disease, either secondary to rheumatoid arthritis or secondary to the methotrexate intake medication. So this is the beauty of applying the clever technique in obtaining the history in the PACES exam. Okay, so number one, after finishing analyzing the presenting complaint, go immediately and ask about any past medical history, any past surgical history. Do you take any medications, any over-the-counter medications? Have you ever taken any medications before or not? And then ask about the family history. Is there any family history of the same illness? Is there any family history of any other illnesses? And then touch the social part. Do you smoke? Have you ever smoked? Do you drink alcohol? How many units per week? Have you ever drunk alcohol? Touch the issue of the driving. It's very important in this, okay, in this case. And ask about the impact of the disease upon job and daily activities. Once you have done all of these, guys, you can come back and ask several questions in the systemic illness, systemic review, although I'm sure 99.9%, if you follow this manner, okay, you are not going to have any need to ask anything in details in the systemic review. You will go immediately to examine the patient. Is that clear, guys?
It's clear.
By doing a quick screening for all of these, for sure you will find a positive things, which will guide you toward mastering the station. Okay? In some cases, yes, you need to do or you need to modify your history taking. For example, if the history or if the case is going toward an STDs, you need to spend some time with asking about sexual history. So modify the history skeleton according to the data you have. Don't take too much time in the history taking. This is the take-home message, guys. Don't take too much time in history taking. Spend too much time in the examination. Now, coming back to the case, diagnosis is a spot diagnosis. So questions to confirm. Now, we have 3 portions. Questions to confirm the diagnosis, questions to look for the causes and associations, and questions to look for complications. Now, questions to confirm diagnosis are, have you noticed any facial changes if you compare all photos with the current appearance? Which is already asked by Dr. Sousan. Have you noticed any weight gain? Have you noticed any change in the size of the ring or feet? Have you noticed any excessive sweating in the palms? Dr. Sousan did not ask about this sweating, and you did not check for it in the examination. Let me ask you now, Dr. Sousan, what is the importance of asking or checking about palm sweating? Dr. Sousan. Dr. Sousan, are you there? Dr. Sousan? Okay. Any other volunteer, guys? What is the importance of asking about excessive sweating?
Activity.
Yes.
Activity.
Thank you very much. It's a sign of disease activity. Thank you very much. Now, go and ask about, have you noticed any difficulties in combing your hair or difficulties in climbing the stairs? And these are very important questions because you are going to check for proximal myopathy. We have confirmed the acromegaly right now. Go to the second part, causes and associations. Any headache that increases with coughing or sneezing, any blurring of vision, any problem in seeing the sides of the road, any nausea or vomiting. All of these questions, guys, will look for features of increased intracranial pressure. Now, we have got a feature of pituitary adenoma. However, we need to look, is it a pure pituitary adenoma or associated with multiple endocrine neoplasia type 1? And don't forget the 3 Ps, parathyroid, pituitary, and pancreas. So go and ask about symptoms of hyperparathyroidism, which are symptoms of hypercalcemia. Have you noticed any increase in passing the urine? Have you noticed yourself become more thirsty than usual? Any constipation? Any history of passing kidney stones before? Is there any family history of the same illness? Okay, now go and ask about the third part, which is the pancreatic, and mainly about insulinoma and gastrinoma. As asked by Dr. Sousan, is there any acid reflux or heartburn? This is for asking about gastrinoma. Or do you have any feature suggestive of hypoglycemia, which is a feature of insulinoma? Any handshakes, any hand coldness, any heart racing, which is already asked also about Dr. Sousan. Then finally, you need to look for complications. As I have told you guys, complications in acromegaly are divided into 2 portions. General complications in the term of weight gain, and you need to ask these 3 important questions in every weight gain. What are these 3 important questions, guys? Any weight gain, you need to ask about 3 important questions. Yes, any numbness or tingling
About
sensation in your
arthritis and
hands
also
to rule out carpal tunnel syndrome. What else?
as an osteoarthritis
Any knee pain. Thank you very much. And
obstructive sleep apnea.
any snoring to rule out obstructive sleep apnea. Thank you very much. This is the triad that you need to ask about in any weight gain case. Now, specifically or specific complications of acromegaly: diabetes, You need to ask questions about diabetes. Hypertension, the patient is already having high blood pressure readings. Cardiomyopathy, and colon cancer. You need to ask questions to involve all of these. You don't need to ask detailed questions, just only one question or two questions in every part. Have you noticed, for example, have you noticed any change in your bowel habit or any tummy pain or lumps or bumps? For example, this is for colon cancer. Any shortness of breath, any heart racing? No, doctor. Thank you very much. Khalas. No need to go into details. However, you are going to tell the examiners that I know complications of acromegaly are 1, 2, 3, 4, 5, and I have touched all of them during my questionnaire with this patient. Now, if you have done all of these steps, in this case, you are a perfect candidate. But examiners are expecting from you to improve your perfection by having a quick summary. Mr. Atallah, you have told me that you have noticed this skin rash 5 months ago. Is that right? And also you have noticed an increase in your weight, especially in the size of your ring and feet, as well as finding difficulties in climbing the stairs. And a couple of weeks ago, you have been hit by a car because you did not see that car coming from your right side. And at the same time, your wife is complaining that you have been suffering from snoring during the night. Is that right? Do you want to add anything else? No, doctor. And now the patient is going to hit you what seems to be the problem, doctor. Now, I want a golden answer from you guys. You have finished, you have told the patient, and now the patient asks you this question. What seems to be the problem, doctor? So what are you going to tell the patient? What's your answer to this question?
Appreciate his concern.
Okay.
And tell him from what you tell me, and after examine you, most probably you have
You did not examine the
condition
patient
called
yet.
acromegaly.
You did not examine the patient yet. You have just finished the history.
Appreciate your concern, Mr. Let me to complete the history table and to examine you. After that, I can address.
Okay, yes, I totally agree with you, doctor. This is a very good question, Mr. Hashim. If you allow me to examine you, then I will get back to answer your questions in details, in addition to other concerns. How does that sound with you, Mr. Hashim? Yes, doctor, thank you very much. And now you go and start examining the patient. Okay? You will find the whole these features in front of you. You need to start the acromegaly. Acromegaly examination is divided into number 1, right, lateral standing, and you need to check for prominent supraorbital ridge or prominent eyebrows, prominent or enlarged nose, enlarged lips, as you can see in this picture in the middle, and increase interdental spacing, and pronounced jaw line. Again, prominent supraorbital ridge, enlarged nose, enlarged lips, increase interdental spacing, and pronounced jaw line. You will also notice an enlarged tongue. I need to ask the patient to swallow, looking for any goiter. This is from the lateral and the anterior aspect. Then the third step is to check for the rashes sites, especially the shoulders and behind the neck. There are 3 important skin rashes in acromegaly. Number 1 is a skin tag. Number 2 is acanthosis nigricans. What is the third one, guys?
Striae.
Striae, thank you very much. So this is the third step. Okay, you need to look for rashes. This is the skin tag, and this is acanthosis nigricans. The fourth step is to check for proximal myopathy. shoulders against resistance, which is a very common sign in patients with most endocrinopathies. The fifth step is to sit in front of the patient and bring a pillow. Ask the patient to put your hand, okay, to put the hand beside your hand, like in this picture. As you can see in the left-sided picture, you want to check for enlargement of the hand. And after that, you need to check for any excessive sweating. After that, instruct the patient to do the Phelan's test, checking for carpal tunnel syndrome. Okay, there is no need to do Tunnel's test as advised by several examiners. There is no need to do Tunnel's test. However, you can ask the examiners, I would like to do Tunnel's test, but do not do it by yourself, because if it is there, it's very painful. Okay, just tell the examiners, I would like to do Tunnel's test, and most likely they are going to tell you, ignore it, doctor. But instruct the patient to do the reversed prayer sign or the Phelan's test, as if it is shown here on the right-sided photo. And then you need to move to the sixth step, which is checking the vision of the patient. The most important two aspects of vision checking in patients with acromegaly is to do fundoscopy, looking for papilledema, as if in this picture, and sometimes you might see optic atrophy. So papilledema, and sometimes you might see optic atrophy. In addition to that, the visual field. And the most likely visual field you are going to encounter in patients with acromegaly with these symptoms is bitemporal hemianopia, as shown in the initial visual field picture. I have brought it for you. And then lastly, you need to go and have a quick listen to the heart, okay? And to check for lower limb edema, check the abdomen for organomegaly, and ask for blood sugar readings. These are the 9 steps of examination of acromegaly. I will repeat them again. Number 1, standing from the lateral aspect, checking for pronounced supraorbital ridge, prominent eyebrows, enlarged nose, pronounced jawline. Then stand anteriorly. Look for enlarged tongue. Look for enlarged teeth spaces. And ask the patient to swallow, looking for any thyroid goiter. Number 3, check rashes, especially above the shoulders. And once you are there, move to the 4th step, which is examination for proximal myopathy. Number 5, sit in front of the patient and put a pillow to compare your hand with the patient's hand. And don't forget to check for carpal tunnel syndrome by doing the Phelan's test and checking for excessive sweating in the palm of the patient. Number 6, checking the vision, visual field, and fundoscopy. Number 7, examination of the heart. Number 8, examination of the abdomen. And lastly, offer to check for blood sugar readings. Is that clear, guys? Any questions? Any questions so far? Can you hear me, guys? Okay. Now, you have taken your history.
Hello, thank you, Dr. Muhammad.
Yes.
For striae, is it pathognomic of acromegaly or to distribute to distinguish from Cushing?
No, actually, striae is not pathognomonic of anything.
Only stretching, skin.
Yes. Okay.
Oh,
Even
yes,
acanthosis
okay.
nigricans, by the way, is not pathognomonic for acromegaly, because you might find acanthosis nigricans in diabetic patients, for example, okay, in pregnant ladies, for example, okay?
Yes.
Yes.
Metabolic syndrome also.
Metabolic syndrome as well. Thank you very much.
Mm.
Now,
Yes.
you have completed history and you have completed your examination. Now, the patient already asked you before, what seems to be the problem, doctor? Now you need to tell him, what did you find exactly? Well, Mr. Atallah, after assessing you, I do suspect a condition called acromegaly, which is a growth of a small gland inside your brain, resulting in soft tissue swelling. And this can explain the whole picture right now. Full stop. Very simple. Now, plan of management, what we need to do now is to run some blood tests. In addition to that, we need to have a brain images, and I will get back to you to discuss the treatment plan. How does that sound with you? What I want from you now is to stop driving because of the current vision problem. After we get the results, I will come back to you to discuss the treatment plan. How does that sound with you, Mr. Atallah? And khalas, your case is done. Is that clear, guys? You will find it too long, by the way, in obtaining the history, and you will find it too long in obtaining or in doing the clinical examination. However, if you train your tongue, because as I have told you, in spot diagnosis cases, okay, you need to make it a gift rather than making it a bomb. Your tongue should be fluent and you need to ask targeted questions. Believe me, if you are quick, if you are asking targeted questions, and if your tongue is fluent, in addition to practicing the case several times, wallahi, believe me, you will master it even before finishing the 15 minutes of the whole duration needed for that station. Okay? Is that clear?
Yes.
That's good. Now, the most important questions which might be raised by the examiners are investigations, treatment, contraindications of some kind of investigations, complication of surgery, signs of activity, differential diagnosis of several symptoms, investigation of bitemporal hemianopia, and the main cause of mortality. Now, let me ask some of you guys, or let me just tell you that the investigation always be systematic, guys. Don't say haphazardly. As I always advise my colleagues, if you have been asked, what is the investigation you would like to take? Say it like this. Investigations are divided into two major portions, two main portions, general investigations and specific investigations. Concerning general investigations in the form of full blood count, renal function, and liver function, in addition to electrolytes. Concerning specific investigations are divided into blood investigations and images. Concerning blood investigations, I will start with insulin-like growth factor 1. And if it is high, I need to confirm my diagnosis by doing the oral glucose tolerance test. Is that clear, guys?
Sorry, please. Voice goes to me.
If the
What test?
insulin, again, please.
Your voice, we didn't hear.
Again, I will repeat. The specific investigations, can you hear me right now?
Yes.
The specific investigations are divided into two main parts: blood investigations and image. Blood investigations, I will start with insulin-like growth factor 1. And if it is high, I will confirm my diagnosis with oral glucose tolerance test. If the insulin-like growth factor is 1, this rules out acromegaly. Concerning the oral glucose tolerance test, normally the glucose should suppress growth hormone. However, in cases of acromegaly, this suppression is not achieved. Okay, then I need to move and do MRI pituitary protocol. MRI pituitary protocol. In addition to that, other investigations to look for complications like diabetes, like hypertension, like screening for colon cancer, etc., etc. Now, one of the questions that is usually raised by the examiners, if you mention insulin-like growth factor, they might ask you, name only one condition in which you cannot depend upon insulin-like growth factor. What is that condition? And actually, this question was raised before. What is the condition in which you cannot send or you cannot depend upon insulin-like growth factor? No, it's liver cirrhosis, because it is mainly excreted by the liver. Now, what is the treatment? The mainstay of treatment is surgical removal of the tumor by transsphenoidal approach. And if the tumor is so big, the approach will be transfrontal approach. However, there are some medicines which might be taken before the surgery. Number one is, what is it?
Somatostatin analog.
Somatostatin analog, thank you very much, octreotide. Now, one of the questions that might be asked by the examiners, what are the side effects of octreotide? Who knows? Have you ever heard about 4 S's? S, 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 and S. Number 1, stone, I mean gallstone, gallbladder stone. Number 2, sugar. It can give you high blood sugar, it can give you low blood sugar readings. Number 3, sinus bradycardia. Number 4, steatorrhea. I will repeat again. Side effects of octreotide, 4 S's, S, 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 and S. The first S is a stone, I mean gallbladder stone. The second S is sugar, either high or low blood sugar readings. The third S is sinus bradycardia, and the fourth S is steatorrhea. Other medications which might be used is bromocriptine and growth hormone blocker, which is pigvosomant, which has a big or has got a huge effect in normalizing the insulin-like growth factor. If the examiner asks you, the patient is not fit for surgery, so what could be the other possibility or other modality of treatment?
Radiation.
Radiation therapy, thank you very much. Now, what are the complications of surgery, guys?
Cranial diabetes insipidus.
Thank you very much. What else?
Infection like encephalitis.
Thank you very much. What else?
Panhypopituitarism.
Panhypopituitarism. What else?
CSF leakage.
Don't forget the recurrence, guys. Recurrence.
Origin
Yes,
disease, yes.
Yes, recurrence of the original disease. And how do you monitor for the recurrence, guys?
Insulin-like growth factor.
Thank you very much. Thank you very much. Now, we'll move to the second question. What are the signs of activity in acromegaly?
Sweating.
Sweating.
Symptoms like a headache and high blood pressure.
Symptoms, okay.
And skin tag.
Skin tags. So the three S's, S, S, and S. Now, what is the differential diagnosis of diarrhea in acromegaly?
Polyps.
Polyps. Good.
Simple infection.
Okay.
Cancer.
Very good. What is the differential diagnosis of headache?
Pituitary adenoma and hypertension and obstructive sleep apnea.
Thank you very much. What is the differential diagnosis of constipation?
Either polyp or cancer or as a part of men when.
Thank you very much. What is the differential diagnosis of knee pain in acromegaly?
Okay, osteoarthritis or pseudogout.
And pseudogout. Thank you very much. And what is the differential diagnosis of milky discharge in acromegaly from the nipple?
Prolactinoma.
Thank you very much. And what is the differential diagnosis of bitemporal hemianopia?
Pituitary adenoma and craniopharyngioma.
If it is upper quadrant hemianopia,
superior it should be pituitary and inferior
lower
it should be
craniopharyngioma. Thank you very much, doctor. Last two questions. What is the differential diagnosis of carpal tunnel syndrome?
Weight gain.
Carpal tunnel syndrome, okay. Weight gain, obesity. What else?
Acromegaly, Cushing.
Entrapping of the nerve.
Okay.
Hypothyroidism.
Hypothyroidism. Thank you. What else? Diabetes, lunate fracture, oral contraceptive pills.
Pregnancy.
Okay. Pregnancy. Thank you very much. Now,
rheumatoid arthritis.
Rheumatoid arthritis. Thank you very much. Now, what is the investigation of choice for bitemporal hemianopia?
Perimetry.
Perimetry test. Now, the last question in this session. What is the most common cause of death in patients with acromegaly?
Cardiomyopathy.
Cardiomyopathy. Thank you very much. Thank you very much, guys. Any questions?
Thank you very much, sir.
No, thank you, clear.
Is it a clear session, guys?
Yes.
Yes, sir.
Clear and informative.
Do you have any questions in acromegaly? Believe me, if you have mastered acromegaly as I have given it to you, you will get 28 out of 28. You just need to be fast and you just need to have a fluent tongue and you just need to practice it several times. Okay?
Okay, Dr. Muhammad, I have a question.
Yes, please.
Hello?
Carry on, yes.
I couldn't understand the relation between prolactinoma and acromegaly, how it is a differential for it.
Yes. Yes. 20% actually of patients with acromegaly, they do have prolactinoma.
Yeah.
Yes.
Because the compression symptoms may cause, prolactinoma.
Yeah.
So
20%.
I mean picture, differential diagnosis for acromegaly. I cannot understand. It can be a feature of acromegaly إنه يكون عندهم prolactinoma أو milk discharge.
Yes.
لكن differential diagnosis wise, you put it with the differential diagnosis. I couldn't get this point.
From where are you getting the prolactinoma? What is the main cause of prolactinoma?
Either from pituitary adenoma اللي هي prolactinoma, otherwise
okay.
Can a pituitary tumor be prolactinoma and to the same time secrete growth hormone?
Yes, exactly. Okay? Always, 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 if you have a patient with acromegaly, look for prolactinoma. And if you have prolactinoma, always look for acromegaly. Rule out the vice versa. Is that clear? Anything else, guys? Any questions?
Thank you, Doctor.
Thank you very much. Inshallah.
Thank you very much, sir. Thank you very much, sir.
You're welcome. Inshallah, I'm going to see you, inshallah, next Tuesday. Thank you very much.
Inshallah, sir.
Hope to see you very well. Best of luck, guys. Thank you.
Salam.
في أمان الله.
Thank